K-pop demon hunters Sajaboy's breakfast meal and Huntrix meal have just dropped at McDonald's. They're calling this a battle for the fans. What do you say to that, Rumi?
It's not a battle. So glad the Saja boys could take breakfast and give our meal the rest of the day.
It is an honor to share.
No, it's our honor.
It is our larger honor.
No, really. Stop.
You can really feel the respect in this battle. Pick a meal to pick a side.
Ba-da-ba-ba-ba.
At participating McDonald's while supplies last.
The world moves fast. Your workday, even faster. Pitching products, drafting reports, analyzing data. Microsoft 365 Copilot is your AI assistant for work. Built into Word, Excel, PowerPoint, and other Microsoft 365 apps you use. Helping you quickly write, analyze, create, and summarize. So you can cut through clutter and clear a path to your best work. Learn more at Microsoft.com/M365 Copilot.
If you're new here, welcome. This is the place where we take the confusing, sometimes frustrating things that kids do and make sense of them most of the time. Some things that kids do are just never going to make sense. Today's story is one you're going to want to hear all the way through because it starts with something very common, but might surprise you. I hope you enjoy when I start episodes with a medical mystery because I've got another one for you today. Here's the case. We admitted this kid to the hospital because he was so constipated. I mean, I apologize for starting out with this, but in pediatrics, we talk about poop sometimes. So this potty-trained 3.5-year-old was having serious problems to the point that we thought he had a condition in which the end of his colon didn't have nerves. We were really worried about a serious underlying problem. And I'm not going to go into detail, but we have several treatments we use in the hospital to manage this problem. So we took care of the immediate issue, and then we were trying to figure out why he was so constipated. After monitoring him overnight, the resident noticed that he only drank milk. He didn't eat a lot of food. And when she mentioned the milk to the mom was like, yeah, I know he needs to cut back because his doctor said that's why he has anemia. And he's also really good about taking his iron. She said she gives him a lot less milk at home, but since he was in the hospital, she felt bad and let him drink more milk. And that's when the resident asked about the iron, and the mom said, oh, he didn't have any problems before he started the iron with going to the bathroom. Yeah. We think he got that constipated to the point that he had to be hospitalized because of iron. It's hard to believe, but an over-the-counter supplement can put a kid in the hospital. And I'm going to tell you why this happened, how to know if your child has anemia, whether they need an iron supplement, and how to choose the right one. I'm Dr. Wendy Hunter, and I'm the pediatrician next door. I'm that doctor friend you call for practical advice about your kid's health. I mix the science of medicine with the reality of parenting. We're talking about anemia, iron supplements, and actually the entire supplement industry. There's more going on here than you would ever guess. The supplement aisle looks like a bunch of small wellness brands, but behind the scenes, many of them are owned by big corporations, including some with ties to pharmaceutical companies. At the same time, there are also many independent brands. So it's really a mixed landscape out there in the supplement aisle. And supplement formulations can be tricky because this entire industry is not regulated. So I've got an industry insider as my expert today. Patrick Monsivais started his career in the pharmaceutical industry before he pivoted. And you may not have heard of him, but let me tell you, he's actually kind of a rock star among pediatricians. I was giving a talk to a group of pediatric residents a few weeks ago, and I mentioned that I knew the CEO of this company called Nova Ferrum, and the reaction I got from the residents, you would swear I said Harry Styles was my brother or something. They were seriously starstruck. They had messages that they wanted me to pass on to him. Anyway, he's just a regular guy and a dad and the founder of the iron supplement company Nova Ferrum. If you've ever had to take iron, and most of you did during pregnancy at the very least, or if you've ever had to give iron to your child, it's challenging. And Patrick lived this too. It's exactly why he wanted to create a better option. Here he is.
I went to the pediatrician and I'm like, man, I'm trying to give her a multivitamin and she won't take it. And it tastes like, excuse me, like rotted fish and old nails. But it triggered something. Being in pharmaceuticals, I'm like, well, gosh, are all the irons this way? I mean, and he goes, yeah. I mean, if you know of something else, let me know.
At the time, there was nothing else. Iron supplements all tasted bad and upset the stomach, so a lot of kids and adults just didn't take their iron. That's what we mean when we say compliance. And as Patrick discovered, it matters.
You don't have efficacy if you don't have compliance, right? Being in pharma, it's all about safety, efficacy, compliance. It has to be safe, efficacious. As I moved forward with asking different doctors, right? I went to different offices and was just asking questions. And I got all pretty much the similar feedback was that compliance.
Like nobody's taking their iron.
Nobody's taking it. They were like trying to take it with a bunch of orange juice, and the old iron formulations, they inundated it with sugar and alcohol. And sometimes they would get the pharmacist at the hospital to a compound pharmacist to create the product. You know, it was just a mess. It was just a chemical mess, just so they could get it down to the baby's stomach.
So what Patrick is describing isn't just a taste problem, it's a formulation problem. Different types of iron behave differently. Yes, there are different types of iron. The ones we prescribe most often are the ferrous forms, and these are absorbed really well, but they're the ones that taste the most metallic and irritate the gut. And honestly, these are the ones that kids spit out. Ferric forms are gentler, but not absorbed as easily. And then there are forms where the iron is like packaged in a carbohydrate shell, kind of like a peanut M&M. And this is the kind of iron that's designed to be easier on the stomach and not set off the bad taste receptors in your mouth. So the forms aren't all the same among products. And of course, there are other confusing factors like how much to give. This is really tricky stuff. Here's what Patrick experienced.
The AAP guidelines, American Academy of Pediatric Guidelines, stipulate you go by weight. The FDA goes by age groups, which I believe the AAP is correct. You should go by weight, right? Because toddlers can vary in weight.
Yes.
You'll have a 2-year-old toddler that can weigh twice as much than another 2-year-old, but it's 3 to 6 milligram per kilogram per day, right? And so if you do the label math, which part of my frustration with the consumer is like, please read the supplement facts. Don't just pay attention to, so-and-so says I should take it and it has, it's organic. Read the label, man. I mean, and I'm not just saying our product. I mean, we have our own benefits. We went through the trouble or challenge of getting a clinical trial done that was published in JAMA. And any physician knows that just getting a publication in and of itself is a challenge. But we spent 6 years with the Pediatric Hematology Oncology Division at Children's Hospital to get a clinical trial. So any iron will raise the hemoglobin, right? I mean, and ferrous sulfate is gold standard. Ferrous sulfate, ferrous fumarate, ferrous gluconate. But they're also known to be very, very harsh on the corrosive lining of the stomach, right? And that's where it breaks down. The iron gets absorbed in the small intestine. The ions in the polysaccharide ion complex that we use are so much easier on the stomach. For example, I'll pay on average $100 per kilogram of the polysaccharide iron complex that I use in the products, right? Whereas ferrous sulfate is like the cheapest metal you can get. It's like 35 cents a kilogram.
Now you can see why supplement companies use ferrous sulfate as their ingredient. It works great. It will treat iron deficiency. Anemia is common, especially in toddlers who are prone to anemia if they drink too much milk or if they don't eat enough iron-rich foods. And milk is a problem because a kid can get full on milk, which doesn't contain iron, so they don't eat as many iron-rich foods, but also calcium is a problem. Nobody knows exactly why calcium blocks iron absorption, but we think it interferes with the cells lining the intestines. It disrupts the transporter that brings iron into the cells. And calcium also reduces how much iron gets released into the bloodstream. So even if a kid does eat enough iron, less of it actually makes into the blood if they're drinking more than maybe 16 ounces of milk a day, especially if they're drinking the milk with their iron-rich foods. When you take an iron supplement, what you're really taking in are iron ions, and those ions are charged. They're tricky. Iron exists in two main forms in the gut: ferric, which is Fe3+, and ferrous, which is Fe2+, if you remember your chemistry. And here's the key. Your body can only absorb the ferrous 2+ form, but there's something else that happens. Once iron hits the small intestine where it's absorbed, the pH is less acidic in your intestine compared to the stomach, and those iron ions, they don't just float around. That environment makes them clump together into a form that your body can't absorb. This is what causes the stomach problems. That leftover clumps of iron sit in the gut, and iron is chemically reactive. It irritates the lining of the intestine, and it also can shift the balance of bacteria in the gut. That's why we see constipation, abdominal pain, and nausea from iron. And it's also why iron has that distinct metallic taste. Those same charged ion properties are what your tongue is picking up on. This isn't just about getting a kid to swallow their iron. It's really complicated by keeping it dissolved long enough to be absorbed and minimizing how much is left behind to irritate your gut. That's why the problem Patrick was trying to solve was a lot more complicated than just making his daughter's vitamin taste better. And there's one more nuance I have to mention, and that is a trick we can use to convert the ferric form to the absorbable ferrous form, and that is using vitamin C. Vitamin C binds to iron and keeps it dissolved. While eating an orange or having spaghetti sauce might work for your toddler, one of the biggest challenges is getting iron into babies, especially premature babies who are all born iron deficient.
A little tiny baby that you can hold in the palm of your hand does not have a lot of acid in its stomach. So my intent was to develop an iron that would just dissolve in water. In fact, our first product was a prescription-only product, and the pharmacist would it would come in a powder form in a bottle, and then the pharmacist would shake it and then give it to the patient and direct the patient to refrigerate it. You can't do that with ferrous sulfate. You can't shake it and dissolve it. So that's what the science was behind all of that. My intent was to have it to where babies can take it. And going back to the NICU unit, the nurses they tell me their feedback, their stories. They give them Novoferrum, the multivitamin with iron, and no worries. Because before they would tell me when they couldn't get the other product, even if something that the pharmacist would try to develop, they couldn't give it to the baby, they would have to give it by IV. And the way their veins would collapse, they're tiny, right? So they would just give it needles in the head, on the scalp. And you can imagine, that's just horrendous just because the baby needs iron. But with our product, the babies don't have to go through that exercise of torture.
Now we've solved the problem of torturing newborns, so this is a good time to take a quick break. Next, I'm going to explain how to treat anemia in a way that's not like being force-fed pennies.
Your little one grew 3 inches overnight. Adorable. Also, expensive. Sell their pint-sized pieces on Depop and list them in minutes with no selling fees. Because somewhere, a dad refuses to pay full price for the clothes his kids will outgrow tomorrow. And he's ready to buy your son's entire wardrobe right now. Consider your future growth spurt budget secured. Start selling on Depop, where taste recognizes taste. Payment processing fees and boosting fees still apply. See website for details.
Eczema is unpredictable, but you can flare less with Ebglyss, a once-monthly treatment for moderate to severe eczema. After an initial 4-month or longer dosing phase, about 4 in 10 people taking Ebglyss achieved itch relief and clear or almost clear skin at 16 weeks. And most of those people maintain skin that's still more clear at 1 year with monthly dosing.
Ebglyss, lebrikizumab LBKZ, a 250 milligram per 2 milliliter injection, is a prescription medicine used to treat adults and children 12 years of age and older who weigh at least 88 pounds or 40 kilograms with moderate to severe eczema, also called atopic dermatitis, that is not well controlled with prescription therapies used on the skin or topicals, or who cannot use topical therapies. Ebglyss can be used with or without topical corticosteroids. Don't use if you're allergic to Ebglyss. Allergic reactions can occur that can be severe. Eye problems can occur. Tell your doctor if you have new or worsening eye problems. You should not receive a live vaccine when treated with Ebglyss. Before starting Ebglyss, tell your doctor if you have a parasitic infection.
Ask your doctor about Ebglyss and visit ebglyss.lilly.com or call 1-800-LILY-RX or 1-800-545-5979.
Chronic migraine, 15 or more headache days a month, each lasting 4 hours or more, can make me feel like a spectator in my own life.
Botox, onabotulinum toxin A, prevents headaches in adults with chronic migraine. It's not for those with 14 or fewer headache days a month. It's the #1 prescribed branded chronic migraine preventive treatment.
Prescription Botox is injected by your doctor. Effects of Botox may spread hours to weeks after injection, causing serious symptoms. Alert your doctor right away, as difficulty swallowing, speaking, breathing, eye problems, or muscle weakness can be signs of a life-threatening condition. Patients with these conditions before injection are at highest risk. Side effects may include allergic reactions, neck and injection site pain, fatigue, and headache. Allergic reactions can include rash, welts, asthma symptoms, and dizziness. Don't receive Botox if there's a skin infection. Tell your doctor your medical history, muscle or nerve conditions, including ALS, Lou Gehrig's disease, myasthenia gravis, or Lambert-Eaton syndrome, and medications, including botulinum toxins, as these may increase the risk of serious side effects.
Why wait? Ask your doctor, visit BotoxChronicMigraine.com, or call 1-800-44-BOTOX to learn more.
We've talked about iron supplements, but why would a kid need to take one in the first place? There are actually a lot of reasons, and it's different at different ages. Our body needs iron to make healthy red blood cells that carry oxygen to our body. And if iron levels are low, the body makes fewer, smaller red blood cells. And that's when kids start to look pale, feel tired, get irritable, or struggle with focus. And the reason this happens is not surprising or complicated. Kids are growing fast, so their demand for more iron is high, but their intake might be low, especially in toddlers who drink a lot of milk or in picky eaters. So that's where iron supplements come in. We give iron as a supplement by mouth because the gut is designed to absorb it. It absorbs it slowly, carefully, and in a very regulated way. The body controls how much iron it lets in, so it doesn't get overloaded, which actually can happen. And diet plays a huge role. Foods like meat, beans, and fortified cereals, they provide iron. And that brings us back to the real challenge, getting enough iron into the body in a way that kids will tolerate. And that's why Patrick chose a very specific form of iron to put in his product.
All of the ingredients that I developed, I certainly didn't have visions of smoking cigars and having my own private jet when I created this company. I created it as pretty much of a labor of love. The investment I made in the company, I invested everything I had to create this company. I just got all the right ingredients and spent quality ingredients, not just inundated it with cheap sugars, dyes. The harsher irons, and going just using the ferrous group, for example, the ferrous sulfate, gluconate, fumarate, and I'm using that because they're pretty much the standard that you see in most irons. You need as much acid in your stomach to break down that metal you just took. Okay, so the reason why you're being told to take vitamin C is people have to understand that the reason why is because it can create even more acid in your stomach to break down the metal you just took. For example, with the polysaccharide iron complex has been around for 30 years. It has a reputation for having very low GI side effects. I can take that polysaccharide iron complex in its finished form and just dissolve it in water, and you won't see the chunks of metal floating around. The iron gets broken down in the stomach where it gets absorbed in the small intestine. So that's where you get some of the constipation too, because and then going back to saying like ferrous sulfate, you'll have those chunks of metal still having not been dissolved in the gut, going back into the small intestine. And then so you're not really getting all of the iron absorbed in the small intestine the way you'd like it to, because most of it, depending on how much you took, has not broken down.
Now it makes sense why iron is hard on the stomach, causes side effects, and you can do something about it. You need to read labels and choose products with gentler forms of iron. I'm not exaggerating when I say that my favorite, and many pediatricians' favorite, is the brand name Yummy. Yeah, that's the name of the supplement. It's made by Novoferrum, and they have other products called Yay and Pow, depending on your child's age. Yummy is a liquid, and the others are chewable. And then there's one called Tasty, that's a chocolate liquid iron. Yeah, Yummy is raspberry grape. The first time I ever heard of Yummy was when I was reading one of my patients' notes after they saw the hematology specialist for having difficult to treat anemia. The hematologist actually only prescribed this, and she wrote in her note the brand name Novoferrum Yummy. That was years ago. So I checked it out, and I found it really was the easiest iron for my patients to take. Just last week, I saw it called out by name in another hematology note for another patient. I really am a fan. Okay, but again, why is iron such a pain to take? Why does it taste so bad?
So iron has this ionic charge on your, say, in this case, on your saliva and your taste buds specifically, because people don't notice until maybe they check their back of their throat, all those little taste buds that are in back of your tongue. And there's a science behind all of that. That's why people have this ionic charge as they taste pennies. Some formulations, again, inundate their formulas with sugar, and that's where the alcohol comes into play. It's because there's a science of having that liquid slip by your tongue and bypassing your taste buds. But you're having to do all this junk to the formulation to achieve that. And sometimes that's not successful. With Novoferrum, and I don't want to give it the science of our formulation because it is patented. It took me a long time to patent that. But we developed a formula where we could still achieve the same success minus having to inundate it with sugars and alcohol. We use talon, a ketamine fruit, and monk fruit to be able to have as a natural sweetener to be able to bypass the taste buds.
And just in case this is on your radar, yes, their products are vegan, gluten-free, and clean label project certified, and they have vitamin C in them to help with absorption. And in the world of supplements, these claims are not always true or easy to find. Here's Patrick.
Supplements aren't regulated by the FDA. Only prescription drugs are. So I just want to stress that. And as a side note, I did go through regulatory because I'm a pharmaceutical company. And just by trade, I don't need to, but I still do things because I just want to be as compliant as possible. That's what's very, very frustrating in the supplement industry. And that really I had to change my train of thought, because having come from pharmaceuticals where everything is regulated, everything is, then transversing into the supplement world where it's a wild west.
Yeah, it's wild. You can buy iron over the counter. You don't need a prescription, but that doesn't mean it's totally safe. Iron is one of the nutrients where the dose matters because too much can be dangerous. The body doesn't have a great way to get rid of excess iron. So this is one of those supplements where you need to talk with your pediatrician to figure out if your child actually needs it and what the right dose is. And the dose depends on the child's size and how deficient they are in iron. There is a difference between iron deficiency and iron deficiency anemia. Iron deficiency is the early stage, when the body's iron storage is low, but the red blood cells are still normal. Anemia is what happens later, when there's not enough iron to make healthy red blood cells anymore. So you can be low on iron before you're anemic. It's kind of hidden, and you might not know, but a blood test can tell you. Most pediatric offices can do a finger prick test for hemoglobin to tell if a child needs to add an iron supplement and how much they should take. And this is something Patrick has considered.
There's a difference with iron deficiency anemia and iron deficiency. That's what's different about iron, because it's not like vitamin C, right? You can give large doses of vitamin C, low dose is still going to be vitamin C. Versus iron, it's on a low dose, it's nutritional. You just need some iron to get by. But iron deficiency anemia is something that, going back to, there's so many reasons why you need it. And then you as a physician can actually, you don't still prescribe it necessarily because it's not a drug, but you do write a script for it.
He's right. And this is something we deal with all the time in pediatrics. We do write prescriptions for iron, not because you can't buy it over the counter, but because we want to make sure a child is getting the right dose. And as you now know, the dose matters. However, when we prescribe iron, we are limited to what form your insurance covers. So even if there might be a formulation that tastes better, like Yummy from Novoferum, or is easier on your child's stomach, we don't have the option to choose it. So here's your practical workaround. You can look at the prescription, find the actual milligrams of elemental iron your child was prescribed, and then match that dose using an over-the-counter product like Yummy or Yum from Novoferum that your child might tolerate better. At the end of the day, the best iron is whichever one your child will take. And maybe that's steak or spinach, you wish. That reminds me, when I was in residency, we did an antibiotic taste test, and I had no idea before then how bad antibiotics taste. If you have liquid iron for your child at home, I dare you to taste it. Let me know what you think. Then you're going to understand why Patrick undertook designing a better iron supplement. They do also make multivitamins, but he's been very thoughtful about this all along.
We could just be a supplement company where we have just bunches of supplements. Our goal is just to focus on iron and just do that. So our whole focus is iron and only iron.
Patrick, thank you so much for joining me and for sharing your personal story and the science behind what you've built. I think this is going to help a lot of parents who are really struggling with this. If you want to learn more, I'll have links to the products in the show notes. And as always, if this episode helped you, share it with a friend because chances are they're dealing with this too. For more from the Pediatrician Next Door, find me on the web at pediatriciannextdoorpodcast.com. If you've got a question about the weird things kids do, send an email to hello@pediatriciannextdoorpodcast.com for a chance to hear your voice on the show. I'm Dr. Wendy Hunter, and I'm the Pediatrician Next Door. This show is produced by Red Rock Music. Make sure to subscribe and leave a review wherever it is you're listening. I'll be back next time with more.